78-year-old male who had multiple bowel operations after a perforated colon is now hospital day 10 in the ICU. He has a history of severe COPD and is currently on mechanical ventilation. The surgical team plans on giving TPN for 3 days, at which point they believe the patient will be ready for enteric feeding. Would you agree to this plan, and where would you place a central line?
I do not agree with this plan. TPN should be reserved for patients who will not be enterically fed for at least 7 days. I will not place a central line.
What are the complications related to TPN?
TPN-related complications include hypophosphatemia, hypokalemia, acidosis or alkalosis, and volume overload. There are also complications related to the catheter, such as pneumothorax, venous thrombosis, and bacterial or fungal infections.
Suppose the patient has received TPN for 10 days already. He is proving difficult to wean off the ventilator. What are the effects of TPN on ventilation?
TPN has a high respiratory quotient, so it may increase CO2 production, making adequate ventilation difficult in a patient with severe COPD. The volume received via TPN may also result in fluid overload, leading to difficulty extubating.
How can you optimize this patient from a respiratory standpoint while continuing TPN?
I would change the TPN solution to give more calories as fat, lowering the respiratory quotient. I would also administer diuretics for volume overload and correct hypophosphatemia.